Medical White Paper, The Daily Beast, the doctor behind the miraculous cure for nonstop coughs in adults and children. Telemedicine peer-reviewed and published, instant and permanent chronic cough cures from around the world in children and adults. Refractory unexplained chronic cough RUCC, diagnosed as the habit cough syndrome, can be instantly and permanently cured in minutes or even seconds, in children and adults simply by watching a YouTube documentary video, or via telemedicine. Peer-reviewed and published accidental medical discovery by Dr. Miles Weinberger, MD, University of Iowa. All pertinent medical research has been peer-reviewed and published since 1685. Note intended to be medical advice. Consult with your doctor for your medical concerns. There is no medical advice in this story. By Dennis and Bethany Butner. Medical fact: there has never been instant and permanent cure for chronic cough in human history, until now, and these instant and permanent cures occur routinely, via telemedicine calls, in office, and by proxy. Dr. Weinberger's instant and permanent cure has appropriately called Miraculous by the Daily Beast in their brilliant story, The Doctor Behind the Miraculous Cure for Nonstop Coughs Here. Medical fact: reviewing PubMed and ResearchGate searches for chronic cough, there were variations on the word suppress and treat, but surprisingly, never the word cure, except as noted below. Not even on the NIH/CDC website, which only recommends honey and sugar. Honey and sugar were also the recipe for cough suppression in the 8th century. Note: if you know of any updates to any information on this page, please advise via habitcough@gmail.com. A life-altering, medical paradigm change in the burgeoning medical practice of telemedicine occurred on February 7, 2019, at 8 p.m. Eastern Time. No doctor or hospital could suppress or diminish our daughter Bethany's 5,000 plus daily coughs, let alone cure her from coughing. No doctor, medicine or procedure at any hospital could provide even the most modest relief, let alone provide an instant and permanent cure. Before her torment ended, she coughed at least 500,000 vicious and violent times. We, as the chronic cough patient's parents, were hopeless, helpless and beyond forsaken. We were desperate. When our historic, curative telemedicine call ended, we were so astonished and dumbfounded that we could barely breathe because our daughter was cured from her horror cough, and we filmed it. Had we not filmed it, and made it into a free documentary on YouTube, not even we would believe what the medical doctors, parents and adult patients around the world now witnesses. Here. Diagnosis: the repetitive, awake, barking cough that is not present once the patient is asleep is the diagnostic criteria. It might take a while for the patient to fall asleep. It matters whether the cough is not present once asleep, only to return once awake. Editor note: multiple patients report that knowledge of the Weinberger procedure allows them to stop their future, awake, coughs during the acute period once diagnosis of habit cough has been met. The Weinberger procedure via telemedicine. The multi-time peer-reviewed and published Weinberger procedure via telemedicine and by proxy is typically and routinely utilized, and referred to, by renowned medical doctors at esteemed and trusted medical centers around the world. Bethany's curative telemedicine session has been called one of the most important Skype telemedicine calls in history. By a renowned pediatric pulmonology division chief, pulmonary and sleep and medicine director, Cystic Fibrosis Center. The doctors, parents and adult patients are flabbergasted at their dramatically instant and permanent cough cures. When all treatment options fail, their patients are referred here to be instantly and permanently cured. In the afterglow, the referring doctors routinely request Dr. Weinberger to provide his chronic cough cure presentation to their medical teams. He is heaped with praise when the astonished doctors realize that there is now a cure for their properly diagnosed adult and child chronic cough patients via telemedicine. Here, utilizing a simple telemedicine call from his office near Encinitas, California, Dr. Miles Weinberger, MD, world-renowned emeritus professor of pediatrics, chronic cough cure researcher and asthma researcher from the University of Iowa, visiting professor of pediatrics at the University of California, San Diego, Rady Children's Hospital, board certified in both allergy and pediatric pulmonology, called the Hopeless, Helpless and Beyond Forsaken Parents Us near Annapolis, Maryland. It was our last and final, desperate plea for our sweet child who violently and relentlessly coughed 500,000 times at 5,000 to 8,000 times per day. If this highly unusual telemedicine call did not work, we were bereft of options. All hope would be lost. On the slight and absolutely absurd chance the telemedicine cure worked, our daughter would be cured, but who would believe this could happen in a telemedicine call? We had to. There were no other options. If it did not work, all hope would be lost for our sweet angel. Little did we know, but we were not the only ones enduring this horrific slow-moving, but endless tragedy. Imagine this sweet child, Bethany, at age 12, violently coughing from the moment she awoke, until she coughed herself asleep. We routinely counted between 5,000 to 8,000 coughs per day every day for almost 3 months. Our low estimate was 500,000 mystery, horror coughs. Some children cough over 20,000 times per day. Some children cough for 5 or more years, 16 to 18 hours per day with no suppression. Some adults report nonstop coughing for more than 20 years. They all have been instantly and permanently cured via telemedicine, in office or by proxy with the Weinberger procedure. We believed what we read about Dr. Weinberger in all of his peer-reviewed and published papers. Dr. Weinberger was the only doctor who ever stated the word cure in any of his manuscripts, papers or studies. My dad picked up a cell phone and began to film the telemedicine call. This issue of Lung was published in 2012. This was 7 years before Weinberger's telemedicine call. If he only knew then, so many more children and adults would have been cured. As we stated on our main page, this simple, drug-free, no-cost cough cure has been hiding in plain sight for thousands of years. We, and the world, are so glad that Dr. Weinberger found it. It worked. Our sweet Bethany was instantly and dramatically cured in mere minutes via a simple telemedicine call. We were beyond dumbfounded. We could barely move or breathe. If we did not film the telemedicine call, even we wouldn't believe what we witnessed. Dr. Weinberger instantly and permanently cured our 12-year-old daughter after 500,000 coughs with a simple, drug-free telemedicine call. Wait, what? Cured from a telemedicine call? No more coughing. Yes, cured. Like turning off a light switch. To quote another parent, Bethany's brilliant telemedicine cure by Dr. Weinberger was instant and quite dramatic. Where she should have coughed 300 times during the telemedicine call, she only coughed a handful of times. Within days, with practice of the Weinberger procedure, she achieved what came to be known as cough zero. So just as Dr. Weinberger stated would happen. What happened next would be one of the greatest paradigm shifts in modern medicine and change the face of curative telemedicine for the next century. The first instant and permanent cure of a cough via telemedicine, in the history of humankind, was filmed, peer-reviewed and published, and is now considered one of the greatest medical discoveries of this century. Imagine a cough-free world. Special note, the original video YouTube telemedicine cure documentary has been peer-reviewed and published, and now resides in the permanent video library at the American Thoracic Society. The Weinberger procedure, instant and permanent cough cure via telemedicine, represents one of the most dramatic paradigm shifts in curative treatment for the number one reason that people go to the doctor: a cough. Now, by utilizing a telemedicine call or by a YouTube documentary that, by simply watching the documentary, the Weinberger procedure has instantly and permanently has cured children as young as 3 and adults with over 20 years of daily 16 to 18 hours of mystery, horror cough all around the world. Each blue and red marker on Dr. Weinberger's World Chronic Cough Cure Map was unsolicited. Each marker represents a hopeless, helpless, forsaken and desperate parent and/or adult patient, and their doctors, who searched out a cure where there had never been one before. Note, each doctor noted has knowledge of, utilized, or referred their trusting patients to Dr. Weinberger's instant and permanent cough cure procedure. They arrived here hopeless, helpless, forsaken and indeed desperate. When they were done with their curative telemedicine treatment or after viewing the by proxy YouTube documentary, their family, friends and doctors are flabbergasted at how instant and permanent their cures were. The Weinberger procedure is designed for critical access hospitals and worldwide telemedicine providers. Fact, there has never, until now, in the history of humankind, been a peer-reviewed and published instant and permanent cure for cough via telemedicine or by proxy, watching a YouTube documentary. Dr. Miles Weinberger, MD, has been curing children suffering from horrific chronic cough since the 1980s. Parents would drive their hopeless, helpless and forsaken children across the country to be diagnosed, treated and cured at the chronic cough research clinic that Dr. Weinberger founded and ran at the University of Iowa for 40 years. His peer-reviewed and published instant and permanent cures normally occurred in less than 30 minutes and drive. Weinberger reports that he and his colleagues all report that curing these patients is highly satisfying. Finally, a peer-reviewed and published, innovative, instant and permanent cure by proxy for the cough without a cause has been discovered. This simple, drug-free, no-cost cure has been hiding in plain sight for thousands of years. Dr. Miles Weinberger, MD, a 40-year pediatric pulmonologist, cough cure and asthma researcher from University of Iowa, has discovered the next big thing in curative telemedicine. His instant and permanent cure brings an incredible paradigm shift to the number one reason that patients visit a doctor in the USA. Show your doctor his cures of the cough without a cause and his cough cure research on ResearchGate. He provides his instant and permanent cough cure as his gift to the hopeless, helpless and forsaken children and adults around the world. In office, by proxy and via telemedicine, read Drive. Weinberger's big story here. This is the full-length YouTube documentary above about Bethany's 500,000 unstoppable horror coughs that culminated in Dr. Weinberger's telemedicine paradigm call that instantly and permanently cured her in less than 20 minutes. Dr. Weinberger's cough cure paradigm peer-reviewed and published paper. Here. Aside from telemedicine and in-office visits, simply watching this documentary, by proxy, has cured numerous children, as young as 3, and adults with over 2 decades of mystery, horror cough. Now, easily diagnosed as habit cough and then instantly cured, moms, dads, adult patients and their astonished doctors from renowned medical centers around the world praised Dr. Miles Weinberger, MD, the doctor who cures the world's coughs. Editor note: it is hard to imagine that until now, with the Weinberger procedure by proxy, in history, there has never been a peer-reviewed and published instant and permanent chronic cough cure. This includes curative medication or procedure, in office, hospital, telemedicine, or by proxy, anywhere in the world. It is even harder to believe that aside from Dr. Miles Weinberger, MD, there seems to be absolutely zero research into a cure, not just treatment, for chronic cough anywhere in the world. The only CDC/NIH approved treatment is honey and sugar, not to mention, there is no cure research for acute cough. There are numerous published papers concerning diagnosis and temporary treatment of chronic cough. None seems to mention a cure. If you find one that we missed, please let us know. habitcough@gmail.com. Editor note: we searched 8 hours per day, all around the world and throughout history, via the internet, for a cure, or even suppression for our daughter's 5,000 per day horror coughs. To say that we found no mention or use of the word cure is an understatement. All we found were variations on the word suppress and treat, but surprisingly, never the word cure, not even on the NIH/CDC website, which only recommends honey and sugar. Then we found Dr. Weinberger's peer-reviewed and published work, and there was cure. Not just one time, but always and everywhere. You can read all about it here. Medical fact: reviewing PubMed and ResearchGate searches for chronic cough, there were variations on the word suppress and treat, but surprisingly, never the word cure, except as noted in this story. Not even on the NIH/CDC website, which only recommends honey and sugar. Honey and sugar were the recipe for cough suppression in the 8th century. Cure the habit cough, and you will halt the transmission of cough aerosol virus spray. Cough aerosol spreads virus, illness and disease. No cough equals no cough aerosol spray. When a person has an undiagnosed and uncured habit cough, they can cough thousands and even tens of thousands of times for 16 to 18 a day. One young girl from Canada had over 20,000 daily coughs. Dr. Weinberger cured her in mere minutes via a Skype call from his office in San Diego to her family's home in northwest Canada. They dry cough, walk 2.5 meters, approximately 8 feet, and then cough again and again, potentially infecting a new group with every cough. Their habit cough can continue unabated for decades. Now there is an instant and permanent cure. The Weinberger procedure instantly and permanently cures adult and child chronic cough easily diagnosed as habitual cough, habit cough, known since 1694 here. Dr. Weinberger is a pediatrician and never saw adult patients. He was quite surprised when adults began to report unsolicited cures from up to 20+ years of refractory unexplained chronic cough. The adult cures began to arrive via email after the Daily Beast story. The Weinberger procedure now instantly and permanently cures adults with up to decades of 16 to 18 hours of daily refractory dry unexplained chronic cough, in minutes via a simple telemedicine visit. Per the Rotterdam study, -10% of adults over age 45, 200,000,000+ around the world suffer from chronic cough, and there has never been an instant and permanent cure via telemedicine, ever until now. The Rotterdam study here states, chronic cough is a common complaint in the general population, but there are no precise data on the incidence of, and prospectively examined risk factors for chronic cough in a population-based setting. Therefore, we investigated the period prevalence, incidence and risk factors for chronic cough in adult subjects. Of the 9,824 participants in this study, 1,073, 10.9%, subjects had chronic cough at baseline. The prevalence of chronic cough increased with age and peaked in the 8th decade. In subjects aged less than 70 years, chronic cough was more common in women. During an average follow-up of 6 years, 439 incident cases of chronic cough occurred with an overall incidence rate of 11.6 per 1,000 person years, 95% C 10.6 to 12.8. In current smokers, the incidence of chronic cough was higher in men. In the multivariable analysis, current smoking, gastroesophageal reflux disease GORD, asthma and COPD were identified as risk factors for chronic cough. Based on these calculations, and with approximately 40% of chronic cough being medically unexplained, there might well be over 200 million adults with refractory unexplained chronic cough. RUCC. Please consult your doctor for a proper diagnosis and treatment recommendation for your chronic cough. Note, variations on these terms are medically unexplained chronic cough MUCC, unexplained chronic cough, UCC, and refractory unexplained chronic cough, RUCC. See more here. If these adults meet Dr. Weinberger's cough diagnosis, then they might be permanently cured by utilizing the Weinberger procedure via telemedicine, or by proxy any and everywhere in the world. Many unsolicited cure reports from adults being instantly cured began to arrive via email to Dr. Weinberger. These cures were from adults around the world with up to decades-long cough that were cured in mere minutes. The patients achieved cough zero. With practice of the Weinberger procedure, Dr. Weinberger's cure is drug-free and at not cost or fee for children and adults when utilized by proxy. When utilized via telemedicine, your doctor might certainly charge you a fee. Show your doctor this simplified referral sheet. Here, telemedicine and the future of adult and child chronic cough cures in rural and medically underserved areas of the world. Until the Weinberger procedure via telemedicine, and by proxy, there has never been an instant and permanent cure for cough in the history of humankind. Ever. Remember that the only recipe for cough medicine since medieval time was and is still honey and sugar. Coughing spreads virus, influenza and disease, which can cause illness and death. Halt airborne transmission of respiratory viruses by curing the cough. Now, available for use online, via telemedicine or in your adult or pediatric doctor's office. Just peer-reviewed and published cures of the cough without a cause here. In the United States, statistics for the world, cough is the most common complaint for which patients seek medical attention, reason for visit, to a doctor, and is the second most common reason for a general medical examination, accounting for more than 26 million office visits annually. HRQ. Half the world lacks access to essential health services, WHO. Int. Public health promotes and protects the health of people and the communities where they live, learn, work and play. While a doctor treats people who are sick, those of us working in public health try to prevent people from getting sick or injured in the first place. We also promote wellness by encouraging healthy behaviors. American Public Health Association. Cough is one of the most common reasons for visits to a medical provider in the United States. In 2012, chronic cough accounted for approximately 10% to 38% of visits to U.S. respiratory outpatient practices. Cough may be a symptom of a treatable underlying condition, however, in 5% to 10% of patients with chronic cough, there is no identifiable cause. Patients with chronic cough have considerable healthcare resource utilization and poor quality of life. As of October 2020, no agents have been approved by the FDA for the treatment of chronic cough. However, several agents, suppression only, not cure, are in various stages of development, and preliminary Phase 3 results for one of these agents are available. The American Journal of Managed Care, AJMC. Until now, there has never been an instant and permanent cure for chronic cough by proxy or via telemedicine in history. Most certainly there has never been an instant and permanent chronic habit cough cure in rural and medically underserved areas of the world. The Weinberger procedure is the first and only peer-reviewed and published, instant, repeatable and permanent chronic cough cure by proxy or via telemedicine in the world. It can work to eradicate the scourge of influenza, virus and disease transmission by human cough-generated aerosols around the world. Cough-generated aerosols are a constant public health emergency that has never been cured until now. The potential for a cure by proxy or via telemedicine from cough is so rare that Dr. Weinberger's name is on every peer-reviewed and published document. Available now and translated for over 2,995,000,000 children and adult/senior native speakers at no cost or fee, in English, Espanol, Deutsche, Talk. What a seminal and brilliant paradigm shift in curative, rural public health medicine. DB helped Dr. Weinberger and his worldwide team to eradicate chronic habit cough in rural and medically underserved areas of the world with his world-renowned Weinberger procedure, by proxy or via telemedicine. More rural and medically underserved information here. Dr. Weinberger's Big Story. Dr. Weinberger's Big Story is a really long read, but when you are done, you will be shaking your head and doing fist pumps for the simple and humble brilliance of drive. Miles Weinberger here. There are so many off-site links for your independent verification and validation that will absolutely amaze you. Habit Cough Diagnosis. By Dr. Miles Weinberger, MD, updated to include acute cough below by Dr. Weinberger on March 19, 2020. The repetitive, awake, barking cough that is not present once the patient is asleep is the diagnostic criteria. It might take a while for the patient to fall asleep. It matters whether the cough is not present once asleep, only to return once awake. Editor note: the characteristics of the self-perpetuating, awake, habit cough is its repetitiveness and absence once asleep. Once the patient meets the diagnostic criteria for daytime habit cough, even while the repetitive cough is still considered acute, less than 4 weeks, treatment with suggestion therapy, Weinberger procedure here, is appropriate. There is no need to wait until the awake cough is considered to be chronic, 4 weeks/child and 8 weeks/adult. Multiple patients report that knowledge of the Weinberger procedure allows them to stop their future awake coughs during the acute period once diagnosis of habit cough has been met. Updated to include acute cough by Dr. Weinberger on March 19, 2020. Note: Dr. Weinberger is a big proponent of patient interaction with their doctors, as are we. Many adults and parents report that they have quite successfully utilized the Weinberger procedure on themselves or their children with numerous instant cures in the first days of their new acute, awake, coughs, long before they become chronic in length. They report their cures to their amazed doctors. Please consult with your doctor. If you attempt to utilize the Weinberger procedure on yourself or your child, you are doing this under your own volition. Editor's special note: this is a rapidly evolving and completely unexpected turn of events. Parents cannot help but want their children to stop coughing. They find Dr. Weinberger's diagnosis, and once they realize that their child meets the diagnostic criteria during the acute stage of cough, they utilize the Weinberger procedure. There is no peer-reviewed and published manuscript on this yet. All I can state is that it is quite shocking, exciting and a great read here.